Hello, good morning. I see several people still logging on. People are kind of rolling in as we get things started this morning. I'll give it a little bit of time here. Peter and I were just chatting before we got started today, saying how we can't believe it's already mid-November. Thanksgiving is next week. And yeah, if you haven't figured out your turkey situation, don't forget to thaw it out, I guess. I feel like I'm behind. I need to start thinking these things through. All right, we're at 10 o'clock, top of the hour. We're going to go ahead and get started. Welcome. My name is Erin Hoisington. I am the Nutrition and Aging Content Director for the Nutrition and Aging Resource Center. And today we are so pleased to bring you Keita Cole to talk about marketing your nutrition program. We know that this can be a subject that seems simple perhaps at first, but really can be a little bit intimidating when we start to look at how can we market our nutrition program and how can we ensure that we're really drawing in the participants that we need. And so we're so happy to have Keita here to share her expertise today. I'm going to read you Keita's bio so that I don't mess it up. Keita Cole is the Aging Program Director for the Nutrition Program at the Tennessee Commission on Aging and Disability. And she's also the Dementia Service Coordinator. In her current position, she oversees the nutrition program for the entire state of Tennessee, including both home-delivered meals and congregate meals. Tennessee has over 200 nutrition sites across 95 counties. Keita also educates and trains others on brain health and dementia to help make Tennessee a more dementia-friendly state. With more than 10 years of experience in the Aging Network, she brings extensive knowledge of healthcare payers, home and community-based services, and aging advocacy to her position. A graduate of the University of Tennessee, Knoxville, with a Bachelor of Science in Business Administration, Keita has a passion for serving others through a person-centered approach that allows independence, choice, and dignity. Keita is a completed Certified Volunteer Administrator credential in April 2021 and is currently pursuing her master's degree in public health, community health, and healthcare management certificate from East Tennessee State University. So as you hear, Keita's busy. So thank you so much for being here today, Keita. I'm going to turn it over to you now. We will have some time in the middle for some questions. So just, as questions are coming up, feel free to write them down, use that Q&A function, and we'll get to them, but wanted to give everybody that heads up. And yeah, welcome, Keita.
Thank you so much, Erin. Thank you for asking me to do this. And thank you all for attending. So today we are going to talk a little bit about, like Erin said, marketing your nutrition program. To better market your program, you have to better understand what marketing is. We're going to break down some of the different things of marketing, and we're going to break it into small little bites. So you'll notice through the presentation, it's our menu of what we're doing today. We're going to have our little courses that we're going to go through so we can better understand how to implement it into our daily work and programs. So today's menu, we are going to talk about what is marketing. Just get that basic knowledge there. Marketing versus branding. What's the difference? Why do we need to know both? What is your target market and how do you reach them? We are going to look at an example of a SWOT analysis. What is it? How do we do it? What does it mean? Why do we need to do one? We're going to talk about how to create a marketing plan, both a monthly marketing plan and a yearly marketing plan, and why you need one. And then we're also going to talk about challenges that come along with marketing. So this is a lot of the basics with marketing. My parents paid a lot of money for me to get this degree, and you are getting it for free just to attending this webinar. So as Erin said, I have a business degree with a concentration in marketing. That's where I started. And now being in the Aging Network as long as I've been, it's definitely paid off to use it for what we need to do to get our information out there. So our appetizer, we're going to talk about what is marketing and why do we need to care about it. So for years, the most widely accepted definition of marketing is from the American Marketing Association, or AMA, and that is a professional organization for marketing professionals and educators. The AMA defines marketing as the process of planning and executing the conception, pricing, promotion, and distribution of ideas, goods, and services to create exchanges that satisfy individual and organizational objectives. So that's a big definition for a not so big word. So let's break it down a little bit into manageable pieces. Central to the definition of marketing is the focus on the customer. We want to make sure we satisfy individual and organizational objectives. We want to make the customer happy. So you could just say that the key to marketing, it's customer service. So, and customer satisfaction. So if our customers, which for us in the nutrition world, that is our meal clients and our recipients, if they're satisfied, then we have completed our task. This is just the individual side of marketing. You also have to consider the organizational side as well. And these organizations could include ACL, which is the government level where we receive our money, the state units on aging, which at the Tennessee Commission on Aging and Disability, that's who we are. We're the state unit on aging. So that's who our meals providers contract with. We also have our nutrition providers. So where we get our food from, those businesses and services that you use to help you get those meals out to the consumers. And then you also have the communities that we serve in. So the city and county officials, the community members, all of those people in the community, those are your organizations that you have to look at when you're looking at marketing. You can't just worry about the person eating the meal. You got to worry about all of those other people too. And we're going to break it down and talk about how we target it, how we break it down into specifics depending on who we're looking at. So let's identify some things that we need to have in our marketing toolbox that we use daily to market our program. You may not have realized some of these things were considered marketing, but they are, just sometimes in different forms. So what our most obvious form of marketing probably is special events. So when you have special meals, like a veterans meal, we just celebrated Veterans Day. So if you did a special event where you invited all your veterans in to have a meal, that would have been a marketing form. You can also have flyers or posters. So things that you put around your meal site or that you use to market your events. Obviously, those are what most of us consider as marketing tools when we're thinking about different things. You also have community networking. So going out into the community and going and visiting with county officials and showing up at events around your county, that is marketing as well. You want all of these people in your community to support your nutrition site and support your program. You have to show the love and support them as well. So you have to do some networking. That is your marketing as well. If you do newsletters, just send out either if it's e-newsletters, so you do them via email, or if you do actual snail mail newsletters, either way, that is marketing. That is an image that you're putting out there. That is something that people are seeing and they're relating to your organization. Community partnerships, again, like we're talking about those, your schools, if you're trying to do intergenerational work, you've got your city and county governments, you've got churches, you've got different things like that within your community. That's part of your marketing as well. Your services, what you do at your nutrition site, is there more than just a meal? Do they come in and do events? Do they have crafts? Do they have aerobics or exercise? You know, those services that you have going on in that nutrition site, those are your marketing as well. Public recognition and awards, brag on yourself. Erin actually got on to me after this presentation that I did not toot my own horn enough. So be proud of what you do. Show the world if you get recognized for something, if you receive a grant, if you get an award, put out an announcement on it, brag on yourself. That is marketing. That is showing that you are investing in the community. That is showing that you are investing in those that live around there and that you care. That helps bring awareness to what you're doing as well. Obviously, a lot of us think of marketing as radio, TV spots, press releases. Most of us in the nutrition world do not have a budget to do those types of things unless you can get some donated time or donated space. So if you can do that, obviously take advantage of it while you can. Of course, we all can't go out and create a commercial, even though we would all love to, just because we don't have the budget to do it. And then social media. Use your social media, share photos. We're going to talk more about photos later on. I have a photography business on the side, as if I'm not doing enough. Photos are a big thing for me. So we're going to talk a little bit more about that later on. And then customer surveys. So ask your clients what they like, what they don't like, what they want to see, what types of meals do they want, what is something that has hindered them from coming. So ask them. That's your marketing as well. Again, it's showing that you're investing into your communities. So course one, we're going to talk about what 4 things have to occur that are prerequisite conditions that must exist. So first is there must be 2 or more parties with unsatisfied needs. So with our nutrition program, that is the needs of our consumers. So you've got to have at least 2 people that are having difficulty getting a meal. So those are your 2 or more parties that have an unsatisfied need. The second prerequisite is one party's desire or ability to meet the other's needs. So this exists with us as nutrition providers, state units on aging, area agencies on aging, and etc. So we have a desire to meet the needs of those people who have their unsatisfied needs. Third is parties must have something to exchange. So we are always exchanging, we are exchanging more than just food. We are exchanging purpose. We are exchanging socialization. We are exchanging community. We are exchanging an opportunity to exercise. We are exchanging a purpose. So you can't think of it as just we're providing a meal and that's it. You're providing way more than that. So, and that's the things that you need to think about when you're looking at your marketing. And so then the last prerequisite is that there must be a means to communicate. The parties need to know each other exist. So this is where marketing comes into play. So you've got to look at these 4 things before you can even dive off into that world of marketing. Now we're going to break it down a little further. So we're going to talk about marketing and branding. So marketing and branding are 2 of the most important aspects of communication to consider. And to make yourself stand out, you need strong branding with clever marketing. So a lot of people think that marketing and branding are the same, but they're not. So we're going to break it down. So marketing. It is what we do to actively promote our program or service. So the marketing strategy details how to communicate with your audience. It is the promotion of the brand. A marketing strategy may involve promoting something new that you're doing or an already existing service. So your marketing is promoting your meals, promoting your activities, promoting what you've got going on at your center, what you've got going on at your nutrition site, what you do. How you communicate it to your audience. Is it through a flyer? Is it through social media? Is it through mailing something out? Is it word of mouth? However you do that, that is your marketing. And then you're promoting your brand. So again, we're going to talk about branding, but you want to make sure that you're delivering the right message out there. So what is your branding? That is your values and what you represent or stand for. So a strong brand image can help existing and new customers identify your program and how it differs from others. Do you want people to associate your meal site with somewhere fun and entertaining and engaging, somebody that cares, somebody that gives back? Or do you want them to think of, oh, it's just a place to go get a meal and that's all we care about? So you have to think about your branding, and it can also communicate the values and create emotional reaction from your customers. So again, when they think of XYZ nutrition site or XYZ senior center, you want them to immediately, that thought that they have, you want it to be like, oh, I love going there. I have so much fun. They care about me. They know my name. It's like the old Cheers TV show. You want to go somewhere where everybody knows your name. So just, you care, you have that value, and you want people to feel welcome, and you want them to want to come back. So that's your brand. That's what you're building. That's that emotional connection that you're making. So think about it. Maybe again, with your surveys, ask people, what do you think about when you hear XYZ nutrition site? Are you happy? Are you sad? Are you indifferent? Are you angry? Are you annoyed? Like what is going on? Because you want to establish that brand so then you can market that out there. So take Nike. When you hear the term Nike, obviously most of the times what you think is athletics, sports, team, shoes, clothing, etc. When you hear the term, oh, I went too far, sorry. When you hear the term just do it, how does that make you feel? So most of the time for me, it makes me feel like I can do anything. It does not matter. I can set my mind to it. I can take care of it. I can get it done. No problems, accomplished everything that I need to do. So Nike has created a brand that is inspirational, motivational, and innovative in sports and fitness. So the goal is to be recognized, and Nike has done that very well. Just do it allows people to feel that they can accomplish anything and overcome any obstacle. They can achieve their goals, and most of the time, goals are related to health and fitness. So they place the swoosh and the term "just do it" strategically in their marketing. And immediately, when you see that swoosh or you hear the term "just do it," most of the time, your mind's going to go to Nike. So they have created a brand, and then they have marketed it to where you immediately associate that inspirational, motivational brand with what you see in their ads. If you imagine, just a lady running down the street, it's a dark lit street. And all of a sudden you don't know what it's advertising. You're just seeing a lady running. And then all of a sudden you see the swoosh mark and you see "just do it." You're like, okay, so they're either selling shoes, they're selling the clothes that she's wearing, or they're encouraging you to get out and exercise. Just do it. Don't let anything stop you. So again, we want to create this when it comes. We want to create this vision when we see this in our nutrition centers. So now we're going to talk about that we know the difference between marketing and branding. We're going to discuss your branding toolbox. So what do you have in there? So things that you may consider your branding toolbox is going to be your name, your logo, your tagline. So what, again, like Nike and "just do it," what feeling that makes you have. You also need to think about your color scheme. If your colors are dark and moody, so you use blacks, you use grays, people are going to associate that with sad. If you look at the Nutrition and Aging Resource Center, their logo, it's red, blue, yellow. Their primary colors, they're colors that are easily recognizable, but they're also bright. They elicit some kind of joy. So you have to think about that. Again, most of us don't even consider that when we're thinking about something. We're just like, this is who we are. And maybe you don't have the money to change it, but when you start doing your marketing, you can start portraying that image. You might not can change your logo. It may be a city logo, and this is what you have to do, and they're not going to pay any money to change it. Okay, that's fine. So let's start using that logo in happy settings with happy marketing materials, happy flyers, happy social media posts. So then people start associating that logo with something that is happy and enjoyable. The images you convey through your pictures. Again, like I said, we're going to talk about pictures a little bit more. What are your values? What are your goals? What's your strategy? Is your goal just to get somebody a meal, or is your goal to reduce isolation and reduce hunger and look at malnutrition? Are those your goals? Or you're just like, I'm just here to get a meal out, I don't really care. And if that's what you're aiming for, that's okay. We want to do a little bit more because with nutrition, we offer those other services. So we want to make sure that we're not I'm just shoving a meal out. This is all I care about. And then your trust, the impressions, the feelings. Again, when people hear your organization's name, they want to trust them. They want to know that's a place I can go get a meal and they're not going to scam me. They're not going to sell my information. I can go there. I can talk to those people. I can find resources and I can do what I need to do. So again, you want to portray that when you're putting that out there with your branding and your marketing. So now we're going to talk about understanding between your marketing and branding. You have to identify your target market. So who are you trying to reach? And you may be thinking, I just want people to come get a meal. Like I said, that's ultimately what we're trying to do. We don't have a lot of money. We don't have a lot of time. We just need to get a meal, get it out, and get these people fed. While that may be true, the ones consuming meals are not your only target market. They are just the most obvious. So what we call low-hanging fruit. So we're going to have to break down our target market into categories. You've got your current consumers and meal clients. So you've got those current people that you're feeding, those current people that are getting meals. They've been coming for years. They're going to show up. You're going to be there, or they've been on your, home delivered meal routes for years. So yes, obviously that's our low hanging fruit. That's our obvious target market. Well, what about future participants? As you all know, with aging, we are growing by leaps and bounds. There's a statistic that my executive director likes to give out. By the year 2030, those who are over the age of 60 are going to outnumber those who are under the age of 18. So that's a big change. We've got these baby boomers that are coming up. So you've got more than just your current consumers. You've got your future consumers as well. You've also got your elected officials. I'm sorry, y'all, my nose is itching. I don't know what's going on. Allergies. These elected officials, your city, your county elected officials, your mayors, your county commission, these are people who you need to reach, who they need to see what you're doing because they have the potential of providing money so you can serve more people. Again, they might not be coming and eating a meal there, but they need to know what you're doing. They need to know what you're doing well, and they need to see how you're impacting their community, because those people that come and eat, those older adults that come and have those meals and sit down and eat those meals, those are the people that are voting for those mayors and those county commissioners and those county executives. Those are the ones that are out there talking about it. They are the ones that are promoting those mayors and saying, look what they're doing for my community. So you want to make sure that you are providing the same information to those elected officials that you're providing to those people that you're trying to get to participate. You also have a market of families. So the families of those that are either already consumers or future participants, you want them to know that, hey, my mom can go there and get a meal. And again, they're not going to scam her. She can trust them. She can get resources there. You want those people to be happy with what they see, and you want those people to want to have their loved one come and visit you. And then the last one is your community members. Again, just those in the community that might have an older parent or an older adult in their family. They might be approaching that age to where they would qualify to come have a meal, or, they might have somebody in their church that they can think of to refer to you. So again, you have different consumers that you need to look at. The obvious one that we spend most of our time looking at is our current meal clients. But these other ones, your future participants, your elected officials, and your families and community members, they're just as important. But you have to target them differently. You have to approach them differently because you're delivering a different message. So that's why you need your branding to be consistent. So regardless of who you're targeting, they know and they associate it with your organization. Once your branding is consistent, then you can do your marketing specifically on how you need to reach those people. So now we're going to talk about a SWOT analysis. So before we start thinking about how we're going to reach those people effectively, we need to make sure we understand our program. So we're going to take a step back and we're going to do a SWOT analysis of our program. It's easy. Again, I went to college to learn this. You're learning it for free. And it's beneficial, and it's going to make sure that you're putting your right message out there. It's also recommended to do this if there's a change in leadership, if you have new goals, if you have new strategies that come out, or an event like a pandemic. We all just went through it. I know most of us don't want to talk about it anymore because we're sick of it. But we just went through this. A lot of things changed in nutrition, especially after the pandemic. A lot of different ways to serve people. Grab and goes become very popular. Are grab and goes beneficial? Do they serve the right people? It's easier for us because we fix the meal, they pick it up, they go. It's easier for those consumers who don't like to eat it in groups in a congregate setting, but is it the most effective way to get the meal out there? Maybe in your area, that is. Your numbers went through the roof when you were doing grab and goes. If you've had to pull back grab and goes now, maybe that's affected your bottom line. You need to do this SWOT analysis to be able to take it to your funders and say, hey, this was beneficial for us. We need to figure out a way to do this again. So what we're going to talk about, what it stands for, is strength, weaknesses, opportunities, and threats. And it is the process where you identify both internal and external factors of your program that are both a benefit and a deterrent. So your strength and your weaknesses are your internal factors. So if you see right here, these are your internal factors. Your strengths is, what are you good at? Serving meals. Your meals taste great. Your meals look good. They're, people enjoy coming there. Your weaknesses, what do you need improvement on? Maybe you've had some complaints on your meals. Maybe the look of your facility is not great. It's harmful, but it's an internal thing that you can adjust. Your opportunities and your threats are your external factors. So your opportunities, where do we need improvement? Do we need to do better at targeting our markets? Do we need to do better at reaching those underserved populations? Are there opportunities there? Do we need to do more grab and go meals because that was an opportunity that we benefited from that we need again? And then what are your threats? What's going to hurt your program? Funding is probably the biggest threat that we all have. I have, in the 2 years that I've been doing nutrition at the State Unit on Aging, have not been on one webinar or one informational session or one event or conference where somebody has said, I've got too much money, I can't spend it all when it comes to nutrition. The majority of us are all like, we need more money, we have more people we need to serve. So funding is obviously going to be a big threat, but it could be something you could overcome. Again, if you're marketing those community members and those community and elected officials, that might be an opportunity for you to get some more funding. So it may be a threat, which is harmful, but it's also something that we can look at. So now we are going to break it down. So an example, so some of your strengths might be your community support, might be your volunteers. It might be the difference that you're making for those individuals that you're serving. Your weaknesses, it could be your food quality. Maybe you have a lot of turnover, either in volunteers or with staff. Accessibility, is it easy to get to your building? Do they know where the main entrance is? Is it easy to show up and get meals? Do you have times posted where everybody knows what it is? Some of your opportunities could be, are there new areas that you need to reach? Learn what you have already done, learn from what you've already done. Again, like we talked about those grab and goes. If that's an opportunity that's beneficial for you, then you can take this information that we're providing and you can share it and you can build on your own marketing plan and you can do your own SWOT analysis to go to your funders and say, hey, this is something we need. It may not be that they don't want to do it. It may just be that they don't know that it was beneficial. So that's an opportunity for you to build on a new area. And then your threats, like I said, expenses and funding, wait list. Obviously, again, because of expenses and funding, we have a wait list most likely. If you don't, congratulations. Let me know how you're doing it, because Tennessee, we need help. And then your reputation. Again, what do people associate when they think of your organization or your nutrition site or your senior center? What are they thinking? Are they thinking this place is terrible, the food is awful, the people are rude, I don't want to go there? If that's what they're thinking, then you need to change your brand and you need to change your marketing, because that's not what you want people to think. So the big thing with the SWOT analysis is make sure you are putting out the right message. And so look at your brand. The threat could be you and not totally understanding what your brand is. Do you confuse people with what you say versus what you do? You could be that threat that's sitting there. Maybe it's not funding. Maybe it's you. Maybe it's your image that you're putting out there. Mixed messages. What photos are you putting out in the community or on social media? Again, you want to show participants are enjoying a good meal and being happy and social. Make it enticing for people to want to join your organization. Look at a perspective, be aware of what is around and move it to get the perfect image. One of my biggest pet peeves, again, have a photography background as well. If I see a picture on social media, I immediately look at the background. I don't know why, it's just what I do. If I see a whole bunch of people sitting around a table laughing and having a good old time, but in the background of that picture, I see an overflowing garbage can, immediately that's what I see. And I think, well, that place is dirty. I don't care that those people are having a good time. That place is dirty. I don't want to go there. If I look at a restaurant and I see, again, dirty dishes are piled up somewhere or something like that, I'm thinking, they don't clean very well. I don't want to go there. What do you look at? If you see an image of something, it does, do you look at it and you think, oh my gosh, it's beautiful? Or do you say, that's a cool picture, but what's going on in the background there? So move around. You can move. You might not can move the people. They're eating, they're having a good time. But look at what's around you. If there's a garbage can in the way, move it. Take the picture, move it back. It's easy. It's simple. It doesn't take long. Just make sure you're putting out that image that you want, because that image is what you're marketing. And if you're marketing a dirty kitchen, then people are going to associate you with a dirty kitchen. So make sure that you're putting out the right message and that people can interpret just by looking. If you have no words or anything, they just see a picture, what are they going to see? And that may be the easiest way for you to think about it. All they're going to see is this picture. What are they going to think when they see this picture? Ask yourself that question. And if you need to retake it, figure out a way to do it. Your nutrition site, how does it work? Do people understand that they can come at a certain time and eat meals? Do they understand how they have to call ahead if they, if you have a call ahead, so you order enough meals? Do they understand that? Do they understand they have to be on a list for home delivered meals? How does it work? Make sure that you're putting that message out there so people are not confused on what they need to do. And then community involvement or lack thereof. If you're not out participating in the community, people will assume that you're unfriendly, and they won't want to participate with you. So make sure you're investing in the community. Bring in local celebrities to help serve meals. Bring in your county mayors. There's one site here in Tennessee. Her county mayor shows up. He helps deliver food boxes. He helps grill. They do cookouts and he will grill and he'll man the grill for them. And all of these, again, he knows those are the people that are voting for him. So he wants to be out there helping them. But also they love to see that he's involved. Bring in your law enforcement, bring in your firefighters, have them come and help serve a meal. Again, the older adults in the community, they like to see that people are investing in them. They want to feel like they matter. And having that community involvement helps. If you have an opportunity to go serve the firefighters at a meal, or if you have an opportunity to go to the elementary school to help do something, or show up at an event, a health fair or something like that, try to make it work out either where you do it or you send a volunteer. Because if you're investing in the community is going to invest in you. And when I say invest, I don't necessarily mean financially invest. Just invest emotionally, support them. And you may think elementary school, those people are not my target market. They have grandparents, they have parents, they go to church. They, their dad may be the mayor. So you have to think about it in all those different aspects. You can't just think that's not my market. I don't need to worry about them. So be proud of what you have and show it off and get others involved and they'll help you show it off as well. Okay, so we're going to take a little, this has been a lot of information. So we going to take a minute, gather our thoughts. Does anybody have any questions? Erin, have you had anything come in, questions or anything before we move on?
A couple questions, but they've been more logistics. I did just have a question in the Q&A that asked about grab and go meals and how that is counted with flexibility. So I am going to go ahead and drop some of those links into the chat. So if you see those things popping up, everyone, those are some really great resources that we do have when it comes to grab and go meals. Otherwise, if anybody else has a question for Keita, kind of at this middle piece of things before we move on, either you can type that in the Q&A or let us know.
Yeah, and grab and go meals, it's controversial. I know we've gone through it as well. It did work really, really well during the pandemic. But a lot of places, because we don't have those flexibilities with spending anymore, it's getting harder and harder to do. So yeah, those resources that Erin is sharing, we use those resources in Tennessee a lot to kind of determine how grab and goes are going to get charged. For the most part, if it is not being consumed in a congregate setting or either through virtual eating or something like that, then it has to be counted as a home delivered meal. If they can, if y'all have a system where you can do it to where it's maybe they eat virtually with somebody or something like that, then it can be counted as a congregate meal. That's a general overview of it. Obviously those resources that Erin has and that I think it's like a branding tree or a sharing, I don't know what it's called, Erin, you might have to correct me on that, but that's a really
decision tree. And I'll share that one as well.
Yeah. Okay. Any other questions?
We do have another question in the Q&A, and it is, how do you get an audience with the mayor or police departments?
So that's a really good question. The best way to do that is just to reach out to them. So find out who their secretary is, their gatekeeper, whatever that person is. Try to call. If you can't get them to respond back, stop by. They're the mayor. Their offices are open. They may not be in there, but their assistants can get you that information. They can let you know when they'll be there. Drop off information about your site. Drop off a business card. Say, hey, I want to talk to them about doing something. I want to talk to them about showing up at a meal site or helping me with a meal. I want to get the community involved in what we're doing. You have to ask. My dad used to always say, you miss 100% of the shots you don't take. So you have to put the effort in there and ask them. Now, is it going to be easy? Are they going to immediately respond? Probably not, because they're going to be like, meh, it's a nutrition site. I don't have anything to do with that. I don't care. But once you start talking to them about, hey, this is how many people we serve. These people are over 60. These are your constituents. These are the people that you're voting for, especially if it's in an election year. They're going to be more likely to show up and help out. But do that initial phone call. If you can't get them to respond on a phone call, I always say drop by. You're harder to ignore when you're sitting there in person than it is on a phone or an email. And again, if it may take a couple of times to stop by before they're going to realize, hey, this person is serious and they want to talk to me. So that's always my best advice on that.
Thank you, Keita. And then we also had someone comment that they have had some luck getting political leaders to join at sites as celebrity bingo callers. I love that idea. Oh my goodness, if I'm ever in your area, I love to call bingo.
Yeah.
Oh, I have something to add to my resume. I love it. Yeah, no, that's really fun, right? It draws them in and it gives them the chance to kind of showcase who they are. And then, yeah, it gives you a chance to showcase all of the great work that you're doing. So thank you for that.
And I just want to say, we all know a politician likes to feel like they're a celebrity. So anytime that you can encourage a politician to be like, hey, you're going to be our celebrity guest. Yeah, that just boosts their ego more. So they're more likely to show up and participate. So again, just make that initial ask. Again, you might try a phone call first or an email first, and then stop by. Again, they're a little bit harder to ignore you when you show up at their door than if you just show up. So, okay. So we're going to go on to the next part now. We're going to talk about planning to make a plan. So we need to put together our marketing plan now. You know where you have room for improvement. You've done your SWOT analysis. You know your goals and your mission, again, your brand. Now you need to have a plan on how to accomplish those goals. So your marketing plan is going to be your roadmap to accomplish those goals and putting your ideas into motion. How are you going to get from point A to point B? It is recommended to do an annual marketing plan and a monthly marketing plan. Your annual marketing plan is your overall goals for the year, what you want to try to accomplish. Are you trying to increase your participants by 10%? Are you trying to reach a new area that you've not been able to reach? Like, what are your overall goals that you want to accomplish in this year? Again, these are like big overarching goals that you want to do. Your monthly plan is more an immediate plan. What specific goals do you want to focus on this month? Is that for the month of January that you want to have a politician come in and call bingo or help serve a meal? All right, so that's your plan for December, is to work on getting somebody in January. So what's your immediate thing that you want to do? That's your monthly goal. And guess what? You can put all your monthly marketing plans together and your annual plan has written itself. So you know what you're doing every month to reach that annual goal. There is no right or wrong way to create a marketing plan. Maybe it's just a list of goals and what you want to accomplish. Maybe it's a focus at certain times of the year. Whatever it is, the biggest thing that you need to do with it is write it down to hold yourself accountable, to hold your organization accountable, and to remind you of what you need to do. So it can be a Word document. You can probably Google marketing plans, templates, and you can find them. There is no right or wrong way to do it. I'm telling you right now, it's just somewhere to organize your thoughts, organize your goals, and what you want to accomplish. A good place to start is a self-assessment for your current efforts. What are you doing now? Is it working? Does it need improvement? Again, do that SWOT analysis. What do your marketing supplies look like? And when I say marketing supplies, I'm thinking, do you have flyers? Do you have a business card? Do you have a brochure? If you don't, that's okay. But if you do they all look the same? Or are they just like all over the place? Are you using the same color scheme? Is your logo consistent? Has your logo changed and you've got old marketing materials with an old logo and now you've got a newer logo? Like, what do they fall along with your brand? Are they bright? Are they colorful? Are they encouraging? What message are you putting out there? If your marketing things that you have now don't meet that brand that you want to create, figure out a way to get some new ones. Again, I'm not saying you have to go out and order 1,000 new brochures. We don't have the budget for that. But maybe it's you take your logo and you take a 8x1/2x11 piece of paper and you create a flyer and you pop that new logo on there with new colors, and that's your new marketing materials. You make 50 copies, you distribute them out with your home delivered meals or however many you have. Again, it's going to cost a little bit of money because you got to have the paper and you got to have the ink, but it's going to be a lot cheaper than buying 10,000 new brochures or whatever, or creating a whole new event or something like that. So again, look at what you have and look at how you can do it. Just because you have that old stuff, and if you're never going to use it, get rid of it. Don't let it sit there, because it's just going to collect dust and it's just going to be in the way. If it's completely different than what the message you're trying to put out there, just get rid of it. Obviously, check with your supervisors and your managers. I'm not giving you permission to just go throw everything out, because then I'll get ugly phone calls. But hey, look at them and say, look, this doesn't put out the message we want anymore. We don't, this is dark, it's dingy. This logo is not even our same logo. Can we get rid of these? Can we throw these away? They're just taking up space. Again, getting rid of those, it's kind of like in your house. When you get rid of clutter, it frees you. When you get rid of clutter in your meal site, it frees you up. It opens you up. It lets you have more room to do better things. So when you start looking at your plan, you need to know the trends in your community. You're like, trends? What's that mean? I know about fashion trends, like what's in and what's out. What do I need to know about my community? Look at your town demographics. How does that impact your goal? Demographic trends to look at include age, town population, projected growth, demographics, ethnicity, gender, what percent of your population is over 60. If you only have 15% of the population in your community is over 60, it might be unrealistic for you to say, I'm going to increase my meal participants by 75%. Well, that's going to be hard, because only 15% of the community is over 60. That's going to qualify for your meals. So that's why you need to know these things. You need to know what you're dealing with so you can figure out what your goals need to be. Where do they live? Is there certain parts of your community, county, city, whatever, where the majority of the older population lives? Is it the old town? Is it the new town? Are they all spread out all over the place? Are they more rural? Are they more urban? Do you cross lines a lot? So where do they live? Because that's going to affect how you get the message out there. In Tennessee, we have a lot of rural locations. Broadband is still not as great in Tennessee as it could be period. But other bigger, the more metro areas, they do more with social media because it's easier to get out there. In the rural communities, we have to do more with mail, snail mail, regular mail, putting things in with different things, getting it to go into health fairs and handing out information. So you have to see where your people are so you know how you're going to market it and you know how you're going to write your plan. What primary language is spoken in what location? Do you have one area of your community where they predominantly speak Spanish? Are your marketing materials translated to where they can understand it? If you have a majority Spanish speaking population and you take a flyer that's all in English and has no Spanish, they're not going to show up because they don't know what you're asking them to do. So again, these are things you have to think about. Do you have a large growing Latino population? If that's the case, maybe one of your goals on your marketing plan is to recruit a Hispanic or Latino speaking volunteer so they can help you outreach to that community or that section of your community. So again, you have to break it down and see what you're doing. Now, most of you, I'm sure, are sitting there thinking, well, that's great, but how do I know where to find this information? This information is accessible. It is out there in your community. So you have to go to your town clerks. You look at your property assessors. Go to your voting office. Again, you're not asking for personal information. You're asking for statistics. You're not asking for addresses to these people with their voting. You're asking for demographics. Where are they located? What's your percentage? Your Chamber of Commerce will likely have a lot of this information because if they're trying to bring in people into your community, bring in businesses, they're going to know the breakdown of this part of the community is more younger. That's where you're going to get more of your people working. So maybe that's the area you want to be in. So again, this information is accessible. It is out there. You may just have to do a little bit of legwork to look at it. In Tennessee, we do what we call, it's a community needs assessment, but then we also break down our aging by county. We have an amazing statistical person that can break it down. She pulls all the information, and I can send the link to Erin, and so she can send it out with everybody for you to look at it. It's on our website, but it breaks down our counties in Tennessee. Every county is broken down into what percentage of the population is over the age of 60. What is it going to be in the year 2030? How many people in that community have a car that are over the age of 60? How many grandparents are raising grandchildren? She gets all of this information from the US Census, and she puts it in this wonderful booklet that you can download and you can print if you want to. It's like 180 something pages, and it's all color, so I don't print it. I just have it saved on my desktop. But then if I know that I'm looking at a specific county, I'm going to pull up those statistics, and I'm going to see, okay, this county has got a lot of people that have, 4 or more, 50% of the population has 4 or more comorbidities. So, okay, they're an unhealthy population. We need to target this population. So this information is out there. You just might have to do a little digging and talk to your state units on aging, talk to your AAAs. Maybe they already have this information that they can share it with you. So, a goal for Tennessee and our marketing plan was to figure out why our participants stopped coming back after COVID. So we know when COVID happened, like all of our nutrition sites had to close down, and that's when we started our grab and goes and our major home delivered. Well, when that was lifted, we noticed our congregate clients were not as apt to come back, and they were still having some difficulties in some areas. So that was a threat that we identified, and we wanted to figure out how could we turn this into an opportunity. So I have to say I was blessed to have an amazing intern that was so excited to do something that would make an impact. So we developed a nutrition survey, and we sent it out to our congregate and home delivered meal clients. Both surveys are very similar on the questions that we asked, but we did ask some different questions depending on if it was for congregate or home delivered. And I have to say that my nutrition sites and my connections at my nutrition sites were amazing in helping deliver this information and getting this information out there. If it had not been for them, we would not have gotten as many results back as we did. So for congregate survey, we included questions about housing and food. So do they live alone? How many meals do they eat a day? We asked about transportation, if they had transportation or if they had someone to call. We ask about physical, social, and psychological health. Do they see people regularly? Do they talk to their family? How would they rate their health? Do they feel lonely or isolated? And then just basic questions about nutrition. Do they enjoy it? Are they satisfied with their meals? Do they like them? Do they have improvements that they want to make? For our home delivered meal clients, it was a lot of the similar questions when it came to transportation. We asked the simple question was, why have they not participated in a congregate meal since COVID-19? The options we provided, was it because they were homebound? Was it they had transportation issues? Did they have social anxiety? Did they have COVID anxiety or safety concerns? And then we put an other in there. So it was open-ended. We wanted to see if there was something that we were missing. The results of the survey kind of blew us away. So I was hoping that I would get about 500 responses, and I ended up with over 4,500 responses. Again, if it had not been for my nutrition sites and the people in those nutrition sites and my AAAs, this would not have happened. So I'm not trying to say that I did this on my own. It was a huge group effort in Tennessee. We received responses from 93 of our 95 counties. So on this map here, you can see that we got all but those 2 little counties there that we didn't get any responses back from. We attempted multiple times. Obviously, the higher the number in that county was, the higher the responses. So some of our counties, so this 529 here, that's Shelby County. So that's a very populated urban county that we have. This is Davidson County. This is Nashville. This is where state capital is and all of that. So again, very urban population. Again, then you have Knox County over here. So it's the bigger cities where we had the more responses, obviously, because there's more people, but we still got, so this county here is my home county. It's Crockett County, very rural, very small. We only got 6 responses, but we got responses. So they only have 1 nutrition site in the county. So we knew that it would affect, those there. So that we had the survey, it was open for 40 days. The average age was 75. The oldest respondent we had was 104. We had 64% female, 33% male respond, and 73% were very satisfied or satisfied with food quality. Again, that was important to us. We wanted to know, did they like the food? Were they unhappy with it? Was there something that we could adjust? And then the isolation correlation was what we expected based on the results. Those who indicated that they did not live alone tend to not feel alone, but those who did live alone feel more alone and isolated. Again, we suspected that that was the case, but now we have the concrete proof that we can go to legislators and we can say, hey, look, we asked the question. We can show you now. Those that are feeling more isolated or those that live alone, we need more opportunities for them. We need more transportation to get them to these meal sites and senior centers. We need more money to do different things. Our older adults who lived alone were more isolated, which leads to health decline. So we had to reach out to those to provide all the information that we can. The top reasons for not participating, homebound or health decline, transportation challenges, and then other. We broke down the other section to see what we could identify across the state. And what we found was 30% was disability related health issues. So they had cancer, their mobility, something like that. 26% was a personal preference. They just didn't want to eat in public. 21% again was other with no explanation. And then 6% was a non-disability related health issue. And then 6% was unaware of our services. So there you go. There was an eye-opening. We thought everybody knew about our services. We got 6% that was like, I didn't know I could go to a senior center and get a meal. I didn't know that that existed. So the overall goal was to increase our number of congregate meal clients. And what we discovered is our number of home delivered meal clients increased by 20% after COVID restrictions were lifted. And the most common issue was homebound. A lot of our older adults, their health declined. So they were no longer able to go out and eat. So it wasn't necessarily that they were avoiding going back to a congregate site, just their health had declined, likely because during COVID, we were all isolated. We couldn't be with each other. So their health declined. They weren't having that interaction. They weren't having that social connection. They probably may not have been getting a good, nutritious meal. So again, another reason that knowing this information is very important. We can infer that the number of home delivered meal clients increased because our population became sicker, like I said, and we took this information and put it into our marketing plan. We wanted to increase awareness of transportation in areas that was a big issue. So for areas that come back and said that they had transportation issues, that's why they couldn't get to their meal sites. We wanted, to create, hey, these are the transportation options in your community. We would send it out to them. We would make sure they got that information. We would put it in with their home delivered meal. So they would have that information. And also we can work with our AAADs to see if there's an opportunity to build a solution around transportation. Sometimes some of our communities are doing volunteer-based transportation. So they're helping to get people there. Some communities haven't done that. Personal preference, the problem by making people aware of the benefits of socializing and having a meal with someone, how that increases overall health and well-being. So for those people that come back and said it's a personal preference, we just don't want to go. We made sure they had information on this is what happens if you don't eat. Your health declines, you become depressed, you become, have anxiety and different things. We encourage you to go eat. So we created some flyers about social isolation and connectiveness and why it's important to, have a congregate meal and eat there. So having this information, the areas can identify their opportunities for improvement and turn their weaknesses into strengths and build their participation back. So was our goal accomplished? Yeah, we felt like we did really good. How did we target our areas? Again, we just kind of looked at, we had overarching concerns statewide. So we just tried to address those as best we can. We're still working on it. It's not done. Some of my Tennessee nutrition sites may be on here and they may be thinking, what is she talking about? We don't know this stuff. I'm still working on things for them. I just recently sent out a flyer for them on the importance of eating a meal together. So for them to print them off and send them out with their home delivered meals. So if there's somebody that maybe could come and get a congregate meal, or if they know somebody else that might be able to, that they know that it's important and why they need to do it. So challenges. Is marketing all glitz and glamour? No, there are challenges. and it's going to be hard, but you never want to hear, I don't want to go back there because the food isn't good. Just like you don't want to hear, I don't want to go back there because those people worry the crap out of me. You don't want to be a used car salesman. That's why all of this previous work that we've done, your SWOT analysis, your targeting your market, your benefits, that's why it's going to help you, because it will focus your message and provide greater feedback. Think of marketing as a tool that you use every day. You are marketing a good cause, and it's a good thing. You're trying to be respectful and efficient, but reach as many people as possible. Be true to yourself and your organization. Strategies are different for everybody. What works for one may not work for somebody else, but sometimes you need to hear what others are doing to spike your creativity. So that's why it's important to attend these webinars and learn different things, maybe seeing and hearing what somebody else does, maybe like, oh, I could try that in my area. It's a similar area. Collaborate with others. Again, work with your people across the state, work with the people in your communities, work with others that are not in nutrition on how you can do different things. And then keep your message simple. Meet your audience where they are, both physically and mentally. You don't want to make it hard to understand. You don't want to make it complicated. You want to use visuals. Again, you want to keep it bright and airy and as simple as possible, because we don't know the reading levels or, what of anybody. We don't want to assume anything. So you just want to make sure you keep it simple to reach the most of your audience. And again, think about different languages. If you have a lot of different languages in your community, think about translating things into different languages. So things to keep in mind when working on your marketing plan: promote a positive atmosphere. We all have room for improvement, but you don't want to start with that. You want to make sure your current and future participants hear. You want to make sure they don't hear about the negative, so keep it positive and happy. Train your volunteers and staff to be sensitive to certain topics and subjects like ageism, inclusion, diversity, etc. So you might have to update some of your forms to, instead of just leaving an option of male or female for gender, maybe you just need to put gender and leave it blank and let them put in what they want. Maybe you need to add an option for what pronouns do they prefer. We're aging. Baby boomers is starting to age where there's more inclusivity and different things. So we want to make sure that we're not leaving somebody out because of our form. So you might need to relook at things like that. Update, like I said, as much as you need to. Simple changes can make a big impact. Put on your image lens and look at your program with fresh eyes and an outside view. What do you want people to think and say about your program? And be visible. Use the image or word as a jumping off point. Think back to your branding. What feeling or emotion do you want people to think about when they hear about your program? If people don't know who you are, then they won't know to participate. So get out in the community, go to events and do different things. This is all considered marketing. It's not just handing out a flyer or showing up and doing a commercial or something like that. All of this is marketing, and this is what you need to think about when you're doing it. So what we've talked about is nothing new, but it's just with your consumers, you must hear it more than once for it to sink in. Marketing is not a one and done. It's an ongoing and ever-changing process. So make sure you think outside the box when working on your plan. Involve your current participants, staff, and volunteers. Ask them, ask for their feedback, ask for their information. That's how you're going to get this out there. If you can, send a birthday card or an anniversary card. On your participant registration form, if you have their date of birth and you have it in the database, try to send them birthday cards. I know it can be a little costly with stamps, or maybe if they show up and it's their birthday, make sure you hand them something. We all want to feel important. We all want to feel like somebody cares and they think about us. The simple birthday card may be like, you know what? They know me. They care about me. I'm going to go back there. I'm going to tell my friends. Use special events and dates to bring in interest. Fall Prevention Month, Grandparent Month, National Ice Cream Day. Again, get creative. This month is, National Alzheimer's Awareness Month. So try to do some like brain healthy activities, do puzzles or something like that to try to get people to come in. Try to think of different things to just think outside the box. The biggest thing is think like a marketer, because you are the face of your organization, and every day you're out there, you are marketing your organization. And it can be challenging because we all have challenging days and we all have days where we just want to shut our door and not talk to anybody. But unfortunately, in our businesses, we can't do that. Maybe you do that after everybody gets done with their congregate meal and they're home for the afternoon, and you take that afternoon to be like, okay, now I want to be in a bad mood. But while your participants are there, you have to be happy and cheerful because that's the message you want to put out there. So this is my information. If y'all need me, I'm always here to help. I can help provide as much information as possible. But that's all I have. Aaron, do we have any more questions that have come through or anything else I can do to help?
Hi, Keita. Thank you so much. We do. We have one question that asked, are you willing to share a copy of the survey?
Yes, I will send. Do you want me to send that to you, Aaron, and you can send it out?
That's fine. And then we can send it out to all the registrants.
Okay.
And then Paul asked, how was data collected? In person, email? Was this collected via paper and pencil survey in each site?
So what we did is we had a paper version that we sent out, and so like for the congregate sites, we had them fill it out while they were there. We also had an electronic version that we provided as an option. But then the paper copies all came back to me at the state. I did not ask the nutrition sites to input any information because, again, they're overwhelmed enough. So all of those paper copies came back to me. Some of them I went and picked up. Some of them we had other people bring in when they were coming to town. Some of them they dropped in the mail. However, we needed to get it and get the information. And then myself and my amazing intern, Madison, manually input all the information into the online form. So then our data expert and statistician could take all that off of the online form and convert it into all the numbers that we have. So I turned it over to Chelsea after I got all the results, and I was like, okay, now it's yours. Tell me what it means. So I'm not a data person. So
All right.
yeah,
We
had a combination of online and paper.
Excellent. All right. Well, thank you all so much. Thank you again, Keita. It's the top of the hour. This recording will be available on our website. And then, yeah, I can send out those resources from Keita as well to all the registrants. So everybody have a great rest of the day and a great rest of the week. Thank you.
Thank you.